How to prepare for your basic life support class.
If this is the first time you are taking a basic life support class, you might have been doing some research to find out what you should expect. This short video will answer those questions for you.
Topics we will cover.
We will be letting you know what to expect, what to wear, what not to wear, some CPR basics, some AED basics, and some choking basics.
What to expect. When you arrive to class, expect to sign in. You may have to fill out a form with information such as your first and last name, your address, your email address, and your phone number. You may have to sign next to your name where your information has already been completed for you. Expect to be asked for proof of identity, so bring a photo ID such as a driver's license, a non-driver's ID, a passport, or an alien registration card. Most classes will allow you to take a drink, but some may limit it to just water. If you are taking the full course, expect to be there for about 4 hours, and if you are taking a renewal course, expect to be there about 2 hours. There are roughly 15 lessons to cover when you take the full course, and there are roughly 7 lessons to cover when you take the renewal course. Expect to be interactive during the class. Most instructors like to hear from students to make sure they are understanding the material. Expect to complete a skills session where you will practice techniques. If you receive an electronic version of your provider's manual, you can bring it with you. You may be provided a hard copy version of the provider's manual. You will have to take a multiple choice test at the end of the class. With all of this in mind, you might want to take something to write with. When you are done with this process, you will be BLS certified. What to wear.
Wear loose, comfortable clothing. You may be standing, sitting, bending, kneeling, and lifting. Wear comfortable shoes. A pair of tennis shoes would be most appropriate. Bring a jacket. Some classrooms can get chilly, so having a light jacket might be helpful.
What not to wear.
Do not wear a mini skirt or a mini dress. You will be bending over to do compressions on a mannequin. Do not wear low-cut tops, ladies. Again, you will be bending over to do compressions on a mannequin. Do not wear high-heel shoes. You want to be able to move around, get to the ground, get back up, and lift things comfortably, without risking a broken ankle. Unless you're sick and cannot postpone your class, do not wear your spacesuit. You want to be comfortable.
The depth of your compressions for an adult should be between 2 and 2.4 inches. For a child, it should be about 2 inches, and for an infant, your compression should be about 1.5 inches. How to distinguish an infant from a child from an adult is a little different in CPR than what you might be used to. For the purpose of CPR, an infant is from newborn to 1 year old. A child is from 1 year old to just before puberty. An adult is from puberty on. Any sign of breast development in a girl or any signs of underarm or chest hair in a boy are signs of puberty, and they should be treated as an adult for the purpose of CPR.
Your compression rate, or the speed at which you are compressing on the person's chest, is between 100 and 120 compressions per minute. This is about the pace of the song, Staying Alive.
The number of compressions you complete when you are alone is 30. No matter how old the patient is, if you are alone, complete 30 compressions. If you are with another trained provider and you are resuscitating a pediatric patient, complete 15 compressions. The number of rescue breaths you complete is always 2 when performing CPR. Never attempt to do more than 2 breaths before returning to chest compressions. When you are doing a 30-to-2 compression to breath ratio, you must complete 5 cycles before you stop to reassess the patient. When you are doing a 15-to-2 compression to breath ratio, you must complete 10 cycles before you stop to reassess the patient. Doing this will allow you to reassess the patient about every 2 minutes. If you are unable to perform rescue breaths, You may do compression-only CPR. When performing compression-only CPR, you will do 200 non-stop chest compressions before you stop to reassess the patient. 200 compressions brings you to about 2 minutes. When doing chest compressions on an adult or a child, you should place the palm heel of your hand on the center of the sternum of the patient, represented in blue, just above the xiphoid process, represented in purple. Make sure you do not press on the xiphoid, especially on a child, and do not press directly on the ribs. This is considered the center of the chest.
When doing chest compressions on an infant, and you are alone, you should place 2 fingers on the sternum of the patient, following all of the rules for an adult or child. When you do chest compressions on an infant and you are working with another trained provider, you should be closer to the feet of the patient with your hands wrapped around the infant's chest so your thumbs are over the patient's sternum.
These are just some of the basics to keep in mind before you take your BLS class. You will learn a lot more during your class. You can practice some of these basic skills at home before your class. The thing students tend to have the most difficulty with is compressions. When performing compressions, you must make sure you are doing them deep enough and fast enough. In the video shown previously, the student was not compressing fast enough. In this video, we see the compressions being done properly. Your instructor may or may not utilize the exact mannequins, but the speed and depth remain the same. There will likely be some sort of visual and/or audio feedback for you, as displayed here. You want to see a solid green light, 2 solid green lights, or red lights illuminating the forehead, depending on the type of mannequin used in your class. Chances are, you don't have a CPR mannequin laying around the house, but you can improvise. You will need something that can be compressed at least 2 inches, that will bounce back when you raise back up. The corner of a mattress tends to work well. Interlock your fingers as shown, lifting up on your compressing hand so the palm heel of your hand is isolated. If you have a physical limitation, don't worry, let your instructor know when you arrive to the class and they will work with you to adapt to the skills to suit your individual challenges. Place your hands near the corner of the mattress, keep your arms locked out, and push down about 2.5 inches. Raise back up, making sure the mattress recoils all the way. This replicates the compression and the full recoil of the chest. Now, we will play a metronome to help you keep the right pace. You can pause the video here if you need to get into position. We're going to practice a set of 30 compressions. Remember, you want to be pushing down each time you hear the click of the metronome. Are you ready to begin? Here we go. You can replay this section of the video as often as you need to feel comfortable with your compression rate. Another thing some students have a difficult time with is managing the BVM on the mannequin. The mannequin has tendency to slide back when you tilt the head back to open the airway. All you have to do is press the head against your thigh so it does not slide back as you open the airway. Remember, only a person without a pulse needs CPR. Also note, never practice CPR on a person that has a pulse, so don't use a friend to practice on. You do not want to compress on the chest of a person that has a pulse if you can avoid it. There is an exception we will talk about in our airway obstruction section. But don't practice doing compressions on your little brother, no matter how much you like to torture. We hope these pointers help you prepare for your BLS class. Remember, these are just some of the basics to help you prepare and do not represent everything you will learn in the BLS class. You will have a qualified instructor that will teach you a lot more than what this preparation video is providing. Next, we will go over AED Basics. We're not done yet. Thank you for watching our video up to this point. Please click the subscribe button and click like. Back to your video.
AED Basics.
In this section, we will cover some of the basics of the use of an automated external defibrillator, known as an AED. When it comes to AEDs, the cutoff between pediatric and adult is 8 years old, but now, biphasic AEDs are becoming the standard, and the machine automatically determines the amount of current that is used when a shock is needed, so you don't have to worry as much about having to remember this. AEDs come in different sizes, shapes, and colors. Just like actual AEDs, training AEDs come in different sizes, shapes, and colors. Your instructor will show you the training AED that they will use in their class, and explain how to use it. The AEDs used in the class cannot deliver a shock, so don't worry. You will learn where, and how to place the pads. You will be asked to wear rubber gloves, or you will be told to act out placing rubber gloves on your hands. Personal protective equipment, or PPE, is very important when performing CPR. Real AED pads do not have any adhesive on the part where the wire attaches to the pad. This is so you can handle the pad with a gloved hand without the glove getting stuck on the pad and being ripped off your hand as a result. So remember, only handle the pad near the cord. One pad goes on the chest, just below the clavicle, and the other pad is placed on the opposite side of the torso, just under the armpit. There should be a diagram to show which pad is placed where. The diagram is usually located on the pads, the machine, or on a folder located inside the machine. Your instructor will help you with pad placement. Some things to remember about AEDs. It is safe to use an AED in damp, moist, and even wet environments such as rain and snow, but the person cannot be submerged in a body of water. The person must be removed from the water and the chest must be dried before placing the pads. The rest of the body can stay wet. You want to minimize the chances that the electric current will travel across the surface of the chest along the water rather than traveling through the chest and shocking the heart. AEDs can be used on a person with a hairy chest. If the chest is extremely hairy, you will want to remove some of the hair so the pads can stick and make contact with the skin. If a person has a thickly matted chest, the pads will stick to the hair and pop away from the skin. If you have a second set of adult pads, you can quickly rip off the first set of pads, which will remove a good deal of the hair. Then place the second set of pads. If there is a razor included in the AED, quickly go over the chest a few times to cut down some of the hair so the pads can stick. Do not take a lot of time to shave the hair down. 4 or 5 swipes should be all you need. There is no need to shave down an area so it is completely hairless. You only need to bring down the hair some. AEDs can be used on people who have implanted devices such as pacemakers or internal defibrillators. If the person is not responsive and has no pulse, their implanted device is not functioning, so there is no concern with breaking the device. You want to avoid placing the AED pads directly over the implanted device. The device could affect the current delivered from one pad to the other by diverting some of the voltage, so you want to orient the pads so they are not directly over the implant. If a person has a medication patch placed where you need to place the pad, remove the patch with a gloved hand. Take the glove off. Wrap the patch in the glove. Put the patch to the side, keeping it inside the glove. Put on a new glove. Wipe the spot the patch was on, then place the AED pad as shown on the diagram provided. The medication patch can take up space the electric grid on the pad needs to contact the skin, which may affect the amount of current that can be transmitted from one pad to the other. AEDs are safe to use on pregnant women. The baby will probably get some of the shock, but if the mother's normal heart rhythm is not restored, the baby will die as a result. AEDs are safe to use on a metal surface. If the patient is on a metal surface, they can be defibrillated. Special care must be taken to ensure pads are not touching the metal surface, and you must be especially careful that nobody is touching the patient when a shock is delivered. There are 2 very important things to remember when using an AED. Number 1 is to turn it on. The first thing you want to do with an AED is turn it on. Do not remove any pads. Don't connect any wires. Do not do anything related to the AED before you turn it on. Number 2 is to follow the prompts. Do what the AED tells you to do. Just remember, turn it on and follow the prompts. Of course, you should use your best judgment. If the person shows signs of life, such as moving or moaning, and the AED tells you to shock the person, do not push the shock button. An AED is designed to shock for one thing: ventricular fibrillation. If you ever speak to a manufacturer of AEDs, they will tell you that their device is only designed to shock a ventricular fibrillation. However, an AED will also shock for an unstable ventricular tachycardia. An AED is not able to distinguish between a ventricular fibrillation and an unstable ventricular tachycardia, so it will shock for either of these two abnormal heart rhythms. The main purpose of an AED is to eliminate an abnormal heart rhythm, or to restore a normal heart rhythm, whichever way you want to look at it. This is important to remember. The way the AED achieves this goal is by delivering a shock to the heart with enough joules that it will temporarily stop the heart, with the hopes that the heart will restart with a normal sinus rhythm. Because the defibrillator stops the heart, it will not shock an already stopped heart. This would be useless. This means you cannot defibrillate a flat line, or in medical terms, an asystole. Again, these are just some of the basics, but this information will help you understand the AED a little better. You will learn a lot more about AEDs in your BLS class.
Choking basics.
If left blocked, a severe airway obstruction can cause a person to stop breathing, have a heart attack, and go into coronary arrest because of the lack of airflow and subsequent oxygenation, so clearing a severe airway obstruction quickly can greatly increase the chances of survival. There are different techniques used to clear airway obstructions. Some BLS courses instruct the use of back blows and abdominal thrusts for all conscious choking victims regardless of age. Some courses instruct that back blows, chest thrusts, only to be used on infants, with adults and children only needing abdominal thrusts. Your instructor will teach you the techniques they want you to use, but we will show you how to perform all three. When you take your class, you may have to partner up with someone else to mock these maneuvers. This means you should not be doing any actual abdominal thrusts, back blows, or chest thrusts on a person that is not choking. If you partner up with a person, you may be required to have physical contact with the person, placing your hands on their abdomen, without actually thrusting. Some classes might have you wear an abdominal thrust vest or combination abdominal thrust, back blow vest so you can actually perform the maneuvers while minimizing the risk of injury to the mock victim. Some classes will utilize adult CPR mannequins that are designed for abdominal thrusts. Almost all infant CPR mannequins are designed for back blows. When performing back blows and abdominal thrusts, remember, this is only done on a conscious airway obstruction victim. Also remember, you always start with back blows. For an adult, you would stand on one side of the victim with one of your shoulders pointed in the same direction as the person's chest and your other shoulder pointed in the same direction as the person's back. Using the hand of your arm that is pointed in the same direction as the person's chest, reach under the person's arm that is closest to you, and grab the opposite shoulder with that hand, while bending the person over to as close to a 90-degree angle as you can. Stand with your feet about shoulder width apart so you can maintain your balance. Perform 5 back blows using the palm heel of your hand and striking between the person's shoulder blades at a rate of 1 strike per second. You should strike with enough force that you would break a wine glass if it were on their back. After you perform 5 blows, stand the person back up, holding onto the person in case they lose consciousness. Move to their back, with one of your feet between their legs. This will help you maintain balance and control if they lose consciousness. Remember, do not take your hands off the person once you begin. Take both of your hands and stick them in front of the victim so your arms are between the sides of their abdomen and their arms. Give them 2 fingers from one hand and ask them to place your fingers on their belly button. You should probably avoid the word navel, because they might get confused. They are in the process of choking to death after all. When you have your fingers on their belly button, take your other hand, make a fist, and place the knuckle of your thumb up against their abdomen, just above your fingers. You should be able to feel your thumb against your fingers covering the belly button. You do not want to push on the navel, because that would be too low and ineffective. You want to make sure you stay clear of the xiphoid process as well. After your fist is in place, remove your fingers from the belly button and place that hand over your fist. In a quick, jerking motion, you want to pull your fist in toward yourself and slightly upward, at a rate of about 1 thrust per second. If you are working on a visibly pregnant woman, or if the person's midsection is wider than what you can reach around, you might have to move your hands up away from the abdomen and perform thrusts on the chest instead. After you complete 5 abdominal thrusts, move back to the side to perform 5 more back blows. Continue 5 back blows and 5 abdominal thrusts until one of 2 things happens. Either the obstruction is cleared, or the person loses consciousness. For a child, you would do the exact same thing, except, you might need to go down to your knees and move them from side to back instead of moving around them. Again, this is only for a conscious airway obstructed child, and will continue 5 back blows and 5 abdominal thrusts until one of two things happen: either the obstruction is cleared, or the person loses consciousness. In your class, you may be told to only do abdominal thrusts on adults and children, and to only do back blows on infants. This video is designed for any BLS instructor to use in order to prepare their students, so classes will differ in this regard. For an infant, you would do back blows and chest thrusts. You hold the infant, always being careful to control the head. They are conscious at this point, so they are moving around. Starting with back blows, you want to hold the infant around the jaw, being careful not to block the mouth or to put pressure on the neck with the baby face down and their head lower than their back. It is easiest if you do this in a seated position so your arms are supported by your legs. Using the palm heel of your hand, strike between the baby's shoulder blades 5 times, at a rate of about 1 blow per second. Be careful your fingers are up and away from the baby's head so you are not smacking the baby upside the head as you perform the back blows. You want to strike with about the same force you would an old glass ketchup bottle. After you perform 5 back blows, you want to grab the back of the baby's head with your hand, trying to clamp the baby between your forearms, and flip them onto their back, with their head lower than their chest. Place your fingers as if you were doing chest compressions for CPR, and perform chest compressions at a rate of 1 per second. This is roughly half the speed you would be doing CPR chest compressions. After performing 5 chest thrusts, return to back blows and continue with 5 back blows and 5 chest thrusts until one of two things happens. Either the obstruction is cleared, or the baby loses consciousness. For an unconscious airway obstruction victim, you want to perform a modified version of CPR. This is the only time you will do compressions on a person's chest without regard for their pulse. Your chest thrusts are more about trying to relieve the airway obstruction than it is to circulate blood, but the same compression to breath ratio and the same compression rate are used. The modification to CPR is that you want to look inside the person's mouth before you attempt to give the 2 rescue breaths. If your chest compressions were able to remove the obstruction, you want to remove the object from the mouth before you give a breath for 2 reasons. You want to avoid taking the chance that you will blow the object back into the airway, and you want to make sure the object is not in the mouth when the person begins to breathe again, and takes their first deep breath, which could result in the object becoming an airway obstruction again. Never do a blind finger sweep. Look inside the mouth, and only if you see something, do you place a finger inside the mouth to remove the object. For an adult, it might be a good idea to place an object in the mouth to prevent them from being able to clamp down on your finger in reflex if they regain consciousness while your finger is in their mouth. Even if you do not see the object, still attempt the 2 rescue breaths. If you are blowing with the proper amount of force, you will not be blowing hard enough to push the obstruction further down the airway. These are some of the basics to keep in mind concerning an airway obstruction. You will learn a lot more in your BLS class.
The basic life support test.
We cannot give you any of the questions in any of the tests, but there are 25 questions in the BLS test. The questions are multiple choice, with 4 possible answers: A, B, C, or D. There are also multiple versions of the test, so you can have remediation by the instructor and be given a different version of the test. You must score at least 84% in order to pass the test. It is rare for a student to fail the course because of the test. Instructors tend to be very good at working with students to help them pass. However, most classes charge you for the time it takes to give the class, not for the issuance of a certificate. This means, for the most part, if you fail the test, you are not entitled to a refund. But remember, it is relatively rare for a student to fail a class because of failing the test. This concludes our basic life support preparation video. Hopefully you have a better idea of what to expect, and you will have less anxiety about your upcoming class. Again, this video does not constitute all of the information covered in the BLS class. These are just some of the things that might take some repetition to remember, and it gives you an opportunity to start the learning process sooner. This video can also serve as a refresher since people tend to forget this information within 6 months to a year of completing the class. You will receive instructions from a qualified, certified BLS instructor in your class. This material was developed by an American Red Cross and American Heart Association certified basic life support instructor with many years of experience, but the information is subject to change as new studies are published and the effectiveness of interventions are reevaluated. I really hope you enjoyed this video. And if you have not already done so, please subscribe and like this video. Respond to this video in the comments section letting us know what other topics you would like to see us create a preparation video for.